Okay, so we're going to start now the session. Now I'm going to introduce Natalia Shartova with her talk about urban walkability in the context of the healthy environment. Welcome, Natalia.
So thank you very much. Well, my work is about urban walkability assessment of Moscow city, and I'm really feel a bit confused to discuss this topic in the current situation after what my government has done and what they continue doing. But anyway, I'm glad to be here, and I'm glad to present my results. So we focus on traditional conception of urban walkability, which combine high density neighborhoods and mixed use areas. It's a very important issue in the context of physical activity or some other issue connected to urban health. And there is a lot of studies refers to walkability in the cities of North America, Europe, and Australia. But Moscow is quite different city. And first of all, it's different in the context of urban forms. Here I have put on my slide 5 different types of residential areas in Moscow. And all of them are connected with a particular time period. For example, it's 5-storied panel blocks of the mid-15th, or high-rise buildings, residential buildings of the end of 1970s. There is also a lot of infill construction in the city center in the light of 1990s. And for the current time, there is a new way. It's about the redevelopment areas. So the previous industrial areas are prepared for new residential areas. So they have 3 main research questions. One of the questions was, and the main important question was, how can we adapt one of the well-known indices to measure walkability in Moscow? The second question is, what special patterns could be identified within city? And the last one, how these special patterns could be linked with other special inequalities, for example, with some social inequalities. They use open data only, so they use OpenStreetMaps. And at the first step, they divided the territory of the city into 2023 districts. It's 15 minutes districts, and they use metro and train stations as the focal points, and we constructed the polygons around these focal points because transport system in the city is quite good. It's quite well developed, and they couldn't use administrative division because administrative districts would be large in the special context, so we couldn't use the administrative division. They use walkability index suggested by Frank approach. There are 3 main components of walkability index. It's residential density, street connectivity, and land use mix. And we have made some modification in this index. So they divided street connectivity into 2 groups of roads. They calculated intersection density for local roads, and they calculated traffic lights density for highway roads, because it's also important that people can cross the highways within city. And they also have added two components of healthy urban environment. We added green space proximity and blue spaces proximity. And each of these components has its own weights based on its importance. For example, green space and blue spaces proximities are the most important, and residential density is less important. Now I'm going to our results. The results for population density, they were quite obvious. We had less populated city center, and they have the most populated outskirts areas. We also found out a strong spatial heterogeneity of street connectivity. It's varied from 37 to 1,374 intersections per square kilometers for local loads. It also depends on the particular area in the city. So, yeah, and this spatial heterogeneity can be explained by historical context. First of all, it could be explained by previous industrial specialization of the areas with low intersection density. So it's also very important because now these previous industrial areas are transformed into residential areas. Land use mix is another important factor. It also was connected to the historic specialization of downtown areas and uptown areas. And also they could compare to different picture for current situation and for the past. And we could see that 40 years ago, there are the very similar spatial patterns of land use mix. Just how to change? And what about green space proximity? Moscow could be identified as a green city. So there are lots of parks and there are also lot of large parks. But we found out two problems connected with green spaces proximities. The first one is relevant for outskirts areas. There are large parks, but they are quite remote from the residential areas. So these parks is quite good for ecosystem function of the city, but it's not so good for population because for population it's not so easy to access these parks. And the second problem is related to the city center because city center has a very mosaic green spaces. So as a conclusion, I can say that the current walkability patterns are determined mostly by historical context. The most vulnerable area is on the east of the city because of previous industrial areas, which now is on active redevelopment. And we also can compare some spatial patterns of walkability index with social stratification of the city. And if we overlap these pictures, we just can see that the most prosperous areas are and the most walkable areas too. In our opinion, it could be more or less a problem for the future development of the city in the context of urban health inequalities. So yes, this is my final slide. I have put here some conclusions, some preliminary conclusions. So they use one of well-known index, but this index was related to the North American cities. So they have made some modifications, and this methodology has brought the results that could be expected. We also identified the strong spatial heterogeneity and walkability in Moscow City. And they also found out that the walkability of Moscow still largely depends on the historical components. And my last conclusion, I think that it's a good basis for future results, because for future investigations, for future research, because we could use this basic of walkability, and they can explore walkability more in the context of thermal stress, or in the context of physical activity, or in some other urban health issues. So that's all. I just can't switch. It's no. So yes, this is my last slide. Yes, thank you for your attention. Well, thank you.
Is there any question for Natalia? Any question? Do you want to do some final remarks? Something else you want to say?
But just can repeat that I am glad to be here to present some of my results and to be in such a great international environment. So thank you.
Hi, Natalia. Thank you so much for your presentation. I'm Juan from Colombia. I used to be the manager for pedestrian projects in Bogota. So I'm glad to see your research. Congratulations, by the way. I'm just wondering if the outcome of your research aims to have any impact in the policy in Moscow, or are you planning to present this to the decision makers? I'm just saying this because I think that this is very important for decision making. Usually the cities are made by planners, but there is a little connection with between the politicians and the planning department. So I think it will be very interesting if these findings may have any impact in policy. Thank you.
Yes, when they were doing this research, they were planning to present maybe in some city government, but actually now I'm not sure. Because the current situation, I'm not sure that it would be interesting for government of the city. Yeah, thank you.
Thank you very much. So now I'm glad to introduce Adalberto Lopes with his talk about urban settings and walking for transportation and approach to cities in Latin America. Welcome.
So hi, folks. It's a pleasure to me to be here with all of you. So today I will present this abstract urban settings and walking for transportation, an approach of Latin America. So our working group is composed of 9 key researchers that is involved in this work, and I'm glad to work together. So the agenda will pass by 5 topics to introduce you something about what we already have in terms of this work that is in development. So the background, starting with this notorious and classical study of John Snow, that in that time already used some mechanisms to evaluate the environment related to disease. Moving forward, Dahl and Hill established a clear relationship between life habits and health. Few years later, Morris addressed physical activity as a behavior that can impact on health. So these three constructs, environment, health, and physical activity, are strongly interconnected. So this framework shows us a little bit about some ecological models that can help us to guide for creating active living communities. Especially based on Bauman ecological model, and plus the updated guidelines of physical activity that advocate every minute count, this concept of snacktivity can be an important way to promote the walking as part of the routine of the people in the cities. So, and why does it matter? Maybe because the physical inactivity is still high, especially for women and in low income countries. So what we know is that city is a complex system, you know, so we don't have a single solution to the problems of the city, but a composite one with several indicators need to work together. So our main aim is to analyze the association between urban settings and walking for transportation in Latin America. Our RQ is to identify how the different urban landscape and street design can impact in walking for transportation. Our hypothesis is based on urban landscape, is places classified as contiguous large ink blot may have the potential to increase the chance of walking for transportation. Related to street design, the spider web configuration may have this potential. So this work is based on the SALURBAL Project. So I invite you to visit our web page to see more about the works and our colleagues. So the exposure that we use in this work is to, by the way, we used 83 informations about Latin American cities in terms of city level. So for the urban landscape, the contiguous large ink blot is set as a reference in this analysis. Also related to street design, here the spider web we set as a better place or better configuration to analyze here. About our outcomes, we used IPAC in 3 countries, Brazil, Chile, and Colombia, based on a self-reported. So we have here 2 approaches. The first one is the meeting recommendation of walking for transportation, 150 minutes per week. And another one is 10 minutes per week that we call regular walking for transportation. So the analytical model includes some variables, individual variables like sex, education, and age, and some environmental variables like social environment index, urban travel delay, gasoline price, and mass transit availability. So our finds shows the majority sample is composed of women with education level, secondary education level, and middle age. About the approaches, the walking approaches, 19% walk long distances. It means 150 minutes per week, and 44 short distance in terms of 10 minutes per week. So in Chile, people walk more long distance, and in Colombia, people walk more short distance. Men walk more long, and women walk more short. As education and age increase, the chance of walking decrease, and better conditions of social environment index increase the chance of walking. Here we can see some results about the exposure. Most majority people live in contiguous large ink blot and spider web with 43 and 62%. It means compact and connected cities. So here you can see some informations about our main findings. So our hypothesis here is partially confirmed, especially for less restrictive cutoff point in terms of 10 minutes per week of walking. However, some unexpected associations are also observed, indicating according to literature, there is no default in terms of urban settings. Another indicator can be more relevant depending on the local context. So in general, we can highlight here that spider web is positively associated with long and short distance, both outcomes. The contiguous large ink blot is positively associated with just short distance, and the proximates are negatively associated with long distances. We need to take in mind some limitations about the study design, about the physical activity measuring. For example, the IPAC show low sensitivity to capture lower rates in terms of walking, and we do not consider the urban microscale. So the results show us that seems to be essential to consider the multi-component of good environment, taking people into account according to promote walking in cities. So finally, our message highlight 4 points. The first one is there is no default in terms of urban settings. The second one is the context. So many people walk in the city, not just because they want or like to do it, but because they need to do it. Also, all urban actors need to be in synergy to solve or to try to solve the problems of the city. And finally, due to the complexity of city and human behavior, multi-component is needed to be in the equation to solve these problems. So also I invite you to visit our webpage of the SALURBAL, and also the Observatory of Urban Health in Brazil. So many thanks for your attention. That's me.
So now I open the mic for any question.
I thank you very much for a really interesting presentation. My name is Pedro Guillón. I'm coming from Universidad de Alcalá here in Spain. I have a couple of questions about your presentation. The first one is that you talked about in the limitations about the scale of the analysis, which I don't think it's a limitation, it's the decision that you made, but have you checked if there is a difference between the within city variability in physical activity or between city variability in physical activity, because you chose that scale, but you might know if the variability in physical activity is higher between cities or within cities, which is something that might be interesting for you. And the second one is that you chose physical activity as an outcome, and I don't know if you have in the SALURBAL in the cities the use of car as a complementary approach of that, and if you have checked that at any moment. Thank you.
So thanks for your questions. It's a very good point. Actually, about the first one, we are in developing this work yet. So we are planning to stratify the same analysis to each city that is involved in this work. So we not have this information yet, but it's in our plan. So the second one is, in my view, I understand the big problem in the cities is the distance between places. So what we can propose kind of like a solution is to promote not just walking, but walking with quality, because many people walk long distance not because they want to do it, but because they needed to do this. So it's good to walk or to promote walk, but with some quality to make different in health.
Hi, it's Palma from University of Granada. Thank you very much. I think it's a great presentation, and I like a lot to include the IPAC with the physical activity. That's difficult to measure, but it's a good try. So I wanted to ask if you did the analysis regarding the difference in the physical activity levels. I mean, light, moderate, and vigorous, because maybe the intensity can be related with the distance. And so some recommendations could be done. If you live close, please go faster. If you live longer, please go slower in order to make better health. Thank you.
Thank you for your question. Actually, we use it both outcomes, both approaches, but when we think to use the short distance, we could some informations about the walking just to include in that idea of snacktivity. So our main idea here is to promote short distance between places. So for do that, we think that's important to include or analyze the informations that people do as part of their routine, because just to meeting the recommendation of physical activities maybe can be too much daily in terms of walking. So here we not analyze the intensity, but just in terms of the total walking for transportation, but divided in these two approaches.
So any other question? So if not, thank you very much.
Thank you.
So now let me introduce Amanda Andrade with her talk about social and environmental characteristics related to leisure physical activity in in Latin American countries, evidence from the SALURBAL Project.
Good morning. My name is Amanda. I am a professor at the Federal University of Mato Grosso. I'm going to present this study, social and built environment characteristics related to leisure physical activity in Latin America countries, evidence from SALURBAL Project. This study was developed in partnership with researchers from Brazil, Colombia, Chile, Mexico, and Drexel University. Ecological models are often used to address the multifactorial aspects of physical activity, with particular emphasis of the built and the social environment. In recent years, there has been increased focus of the role the urban environment in relation to physical activity. More people live in cities, increased evidence that the urban design affects public well-being and health. The goal of the study is to investigate the association between social and built environment features of urban areas and leisure physical activity among adults living in Latin America countries. This study is part of SALURBAL Project, a partnership with among Drexel University and institutions of Latin America. The project analyzes how urban environments and urban policies impact the health of city residents in Latin America. Integrated health survey was used from Brazil, Chile, and Colombia. Data is disaggregated by individuals, subcity, and city. The outcome was leisure physical activity evaluated using the International Physical Activity Questionnaire. It was classified according to the recommendation for the WHO. The social and built environment were used as contextual variables. 3 indicators for the social environment obtained from census data in subcity level: living conditions, service provisions, and educational attainment. And 5 variables, the built environment, were used in subcity level: population density and intersection density. In city level, fragmentation of urban development, percentage of urban area, isolation of urban patches. Multi-level logistical models was used in 3 levels: individual, subcity, and city, adjusted by age, sex, education, and the country. Most the individuals was female from the age 35 to 59 years old and high schooled. The percentage of leisure physical activity was around 50% and higher in Brazil. It was more frequent in males, younger, and more educated individuals. We then fit 3 models, adjusted by count, sex, age, and education. Model 1 included 8 variables, 1 by 1. Model 2 included all the built environment variables jointly. Model 3 included all of the built environment variables and living conditions jointly. We observed positive association among physical activity, living conditions, and intersection density, and negative association with population density. The physical activity levels is affected by complex and dynamic relationships among individuals, social, and environment factors. Our results highlight the importance of urban policies and interventions related to improve living conditions and city connectivity, to increase physical activity levels and reduce inequity in the Latin America countries. Promotion of physical activity contributes to sustainable development. I would like to thank the SALURBAL Project for having me at this event. Thank you.
Is there any question for Amanda? So would you like to share something else, Amanda?
No. Thank you.
Okay, so thank you very much. Yeah, so this is the end of the session. So thank you everyone for for being here.